5 to 20% of the population contracts flu every year. You do not need to be one of them. Preventing the flu can be easily achieved when you know the right techniques as well as the symptoms of a common and severe flu. While it is hard to determine a common flu from the cold, here are the common flu symptoms. Fever, body or muscle aches, headache, feeling tired or weak, cough, sore throat, runny or stuffy nose, and stomach issues. If you have these symptoms, you should call your doctor within 48 hours for advice. You should also stay home, rest, drink fluids, and take medicine for your fever, such as Tylenol or ibuprofen. You need to seek immediate medical attention if you have the severe flu. Severe flu symptoms include shortness of breath, coughing up blood, pain or pressure in your chest pain, trouble balancing, and becoming confused. Both the common and severe flu can be prevented. It is easily prevented by getting a flu shot. And you may ask, how often do I need to get a flu shot? And the answer is, everyone over the age of 6 months should get a flu shot annually. You should also stay home when you're sick. It's hard when you run a busy life, but it's important to yourself and others that you stay home. Other ways to control the spread of the flu are cleaning your hands, covering your coughs and sneezes, keeping surfaces clean, and avoid getting too close to those who have contracted the flu. If you do come in contact with someone who has contracted the flu, you should make sure that you clean your hands after touching them and clean anything that they have touched that you may touch. I want to reinforce the importance of doing what you can to prevent the spread of the flu. Here is a story of a family whose lives were changed forever by the flu. This is the Chandler family story. On Saturday, February 13th, 2010, 4-year-old Chance Chandler was at his father's house for the weekend. He had been at a friend's birthday party all day feeling fine and running around. But later that evening, he started vomiting and running a fever. Chance's father was up most of the night caring for him as he vomited almost continuously. The next morning, a prescription was called in by his doctor and given to Chance to help with his vomiting. At 5 p.m. that evening, Chance went back home to his mother's house, but was still very sick. The medicine had not helped much. A few hours later, Chance was so sick that he could not stand, walk, or even sit up by himself. His mother called a friend to come and sit with Chance's 2 sisters while she took him to the emergency room. While at the emergency room, they tested him for strep throat, influenza, and ran a chest x-ray. The chest x-ray came back clear, and the strep test came back negative, but the influenza test had come back positive. The doctor prescribed Tamiflu and sent him home. Chance's mother was up most of the night watching over him. She was worried, because he kept moaning in his sleep like he was in pain. The next morning, on February 15th, Chance's mother made him a doctor's appointment with his pediatrician for the next available appointment that day. In the meantime, his mother went to the pharmacy to fill the Tamiflu prescription. As soon as she got home, she gave Chance the medicine. However, shortly thereafter, Chance quit breathing. Chance's mother did CPR while waiting for the paramedics, but it was too late. The paramedics were not able to revive him. Chance had been vaccinated against the flu the year before he got sick. However, his family did not know that the vaccine changes annually, and as such, people need to get vaccinated every year. By preventing the spread of the flu, you can change the lives of families around you and prevent things like what happened to Chance happening to the ones you love. Thank you.